welcome to Mother Care. My name is Marian, and it's always a pleasure and privilege bringing the program to you every week. Thank you so much for being a part of today's edition. And today's episode is something I really can relate to: weight gain in children. Have you ever heard when you complain about your child being like really skinny, and then somebody tells you, oh, when you were young you were like half that size, so therefore what do you expect to reproduce? And you're thinking, really? So today I and a lot of other moms will have all our questions about weight gain answered by our doctor. But first, a mini documentary on what weight gain really is about in children. And when we come back, what are moms talking about when it comes to weight gain in their kids? Stay with us. It is Mother Care. Welcome back. It's still Mother Care, and it's all about weight gain in children. So what do moms think about weight gain? Are you one of those moms who is forever comparing your kids to other kids and thinking, what's going on? Why is my kid not adding weight? I know I was in that boat for quite a long time. But what do moms on the street think about that? Are they concerned about weight gain in children, and do they have solutions or opinions about what weight gain in children is about? Stay with us as we find out from the streets.
A mother's love is the same in every language and every nation. Mothers have hope for their children. A mother's love has a will, but not always a way.
Welcome back. It's still Mother Care. Now, it's a pleasure to have with me Dr. Emeka Ugo. He's a pediatrician. And today, Doc, first of all, welcome to Mother Care.
Thank you very much. It's my pleasure.
Today we're going to be talking about weight gain in children, because moms, we compare our kids with others all the time. You see a chubbier baby, you look at your baby, and you're tempted to say how old, and it's
Yes.
And you're thinking,
or even comparing to the earlier children.
yes, or sometimes you even have twins, and one seems to just be flying high, and another one is just down there. So today we want to deal with weight issues in children. First of all, let's start from when they were born. We have people that say, 3 kg, 4 kg, 2.5 kg. What should I expect when I have a child? First of all, what's the weight gain I expect? Should I expect anything in the first couple of weeks, first couple of months? Should I get worried if I feel my baby is not gaining weight or seems to me to be losing weight?
Yeah, thank you very much. I think the first thing is a woman who's pregnant needs to deliver in a health facility.
Okay.
It's very important to know the weight of your child at birth.
Okay.
There are many women, you ask them, what was your child's birth weight? She'll say, I didn't know. They say 3 point something, 12 point something.
Wow, okay.
It's very important to actually know what the weight is,
Okay,
so that
really?
you know if the child is
progression.
gaining or losing or not gaining at all.
So,
Really, whether you should be worried, the first 7 to 10 days of life, the first week of life, a child is actually not expected to gain weight. In fact, the child is expected to lose weight.
Really?
So the mother shouldn't worry, but there's a limit.
There's
The
a
child is
limit.
not expected to lose more than 10% of the birth weight.
okay.
But because the child's body at that time, there is a proportion of water that makes up the body, so they tend to lose a lot of water
Okay.
at that time, and they are feeding very well, but you just notice that the weight will be dropping.
Okay.
If the mother checks 3 days later, she could say, my baby was 3.5, now it's 3.4.
Mm-hmm.
So, but there's nothing to worry about, especially if it's not above the expected limit.
Okay.
But the child is expected to gain weight after like 10 days from
After
the
like 10
second
days.
week of life.
Okay, so you
Yes.
should begin every time you go for, say, immunization and
Yes, you need
checkups.
to check
There
the
should
weight.
be a weight gain.
Weight monitoring.
Okay.
Yes.
Now, let's come to those kids that seem not to increase a lot. You know, somebody you might not even have started as a very small baby, but it seems like when we all put our babies, we all sit down waiting for the doctor. Some people's babies just seem to look chubbier and rosier than yours. When should I be worried?
Whether your baby is chubby or not depends on several factors.
Okay.
The birth weight of the baby. A baby that is born should not be less than 2.5 kg. If the baby is born at
Full
term,
term. Okay.
is born after 9
9
months,
yeah.
baby should not be less than 2.5 kg.
Mm.
And then, if the baby is preterm, there are expected weights for each
time.
gestational age that the child is born.
Okay.
So the mother is supposed to go for follow-ups after the child is born. It's not only when they go for immunizations. Every baby that is born is supposed to attend even a well baby clinic.
Wow. Okay.
So there's a well baby clinic. It's not only for the sick babies.
Okay.
So the baby is supposed to have a registration in the hospital and a folder. There should be records of the baby's weight and other developmental indices and all the other measurements of the baby. So those are supposed to be followed up.
Okay.
And there is a regular period of follow-up. And at each visit, including the immunization visits, the weight of the baby is supposed to be checked. And there is the weight that is expected. Every doctor knows how to calculate the expected weight. Of course, that is a rough guide, especially in our environment. What you are looking at is actually the 50th centile.
Yeah.
You know, that is the middle point that you expect it to be. But there are charts, there are growth charts, and many of them are printed on the immunization.
Yes, I was going to say that it's actually there.
Yes, so they are supposed to be plotting it because every child actually has its own part. The child has the growth curve. So if a child may actually still be within normal weight range, but he's already deviating from his own personal normal weight. Okay. So you are supposed to identify those fault trends and intervene early or investigate early. Okay. So when you see a child, it's possible most of the time it's because the child is not taking enough. Yeah, because the weight you add is what you've taken. So in an environment, mostly it's because of inadequate intake. But there are also those that are caused by diseases. Okay. So those diseases may be because the child is not taking well, and there may be obstruction in the path. The child may be vomiting more. Those ones, and then the child may be having diarrhea diseases that the child is passing more than normal. Or the child has any other disease that is making the child break down more than normal. So those are the possible causes of that the child is not gaining weight. Even HIV, tuberculosis, some of those diseases are consumptive in their nature. So
it will affect the weight gain.
Yes, but the first place to start is to know whether the mother is taking, the child is taking adequately. And breastfeeding is what actually will assure you that your child will gain weight, at least in the first 6 months if you are doing exclusive. Because everything that the child requires in the appropriate proportion and the appropriate quantity is there. The first part of the breast milk and the last part, they are different. You have a lot of fat in the last one and you have a lot of sugar in the initial one. That will make the child suck more. Then the fat will make the child satiate. The child will be satisfied. He doesn't want to suck again.
Really?
And the mother needs to breastfeed the child. It's very enjoyable. You see mothers feeling very fulfilled when they breastfeed their children. And once you're breastfeeding your child on demand, and there are many signs to know that you are breastfeeding your child adequately. Okay. From the mother.
Give me one sign.
Yes, one sign. Well, where you are breastfeeding the child very well, the other breast will be dripping.
Oh, okay.
Dripping. And then for the mother, very few women may be exceptions, but the mother's menstrual period will not come very early. Oh, so you are feeding the child on demand. It's not, some people say feed every 3 hours. No. You feed, there's a rooming in. The mother and the child are supposed to be together all the time.
Doc, you don't want us to go to work.
No, it's not even the work I'm worried about. It's the men. Some men don't want their wives to be with the baby.
I know we're talking about weight, but now they're talking about this breastfeeding on demand. There's this thing, timing. hourly, 2 hours, 2 hours, 3 hours, that, well, younger mothers we've learned. So you're saying you should just feed on demand.
On demand, because that's why actually there's a government policy that every woman who delivers should have 4 months.
Really?
Yes.
My office didn't know that.
A woman should be away from work for 4 months.
Really?
And those 4 months, we expect the woman and the baby to be together for the 4 months.
Doc, some offices will employ only men after this. Okay, let's go back to the weight issue. Now your child is growing. We hear phrases like, I personally have heard my mom tell me when I complain about my daughters, which said, when you were small, you were half her size. People sometimes attribute it to genes. Does that happen with children? Does it work?
Genes are very important.
Okay.
There are some genetic disorders actually that can actually the issue of weight is multifactorial.
Okay.
Meaning that your genes will bring the limit.
Okay.
The gene always creates the limit.
Okay.
But now the food you take what will make you get to that limit or not.
Okay.
So it's like the genes set the standard. And then if you're feeding very well, you will meet your limit. Your limit may actually not be up to the normal.
Okay.
If your genes you have abnormalities. In fact, there are cases of Down syndrome, Turner syndrome. They usually gain weight poorly.
Okay.
And then some children who have some cerebral palsy, or children that maybe they didn't cry at birth, and then they have some brain damage. There is a problem with coordination of swallowing muscles, and they don't take in appropriately. So those things affect that. But usually in the first year of life, the role of gene, is very minimal. It's very minimal. Okay. What is important at that time is what the child is taking in. Yes.
What about those children that will just not eat? You try everything. I mean, when you're done with the breastfeeding thing, you've done the potato with fish, you've done it all, but they just can't seem to take in so much at once.
The issue is there has to be patience.
Okay.
When you're feeding a newborn, some of them regurgitate. Some mothers, after feeding, that's why we say you should breastfeed the child on demand. After feeding the baby, you need to hold the baby for some time. And some mothers wait until the baby cries before they feed the baby. So if some babies take small at a time, but they may take many times in a day. That's why it's important to feed the child on demand. Okay. But if you are saying let this child take so much at a time,
once.
And if the child takes so much or takes a little, and you are saying 3 hours time is the next feed, that's the problem.
Doc has come back to this on demand. Thank you so much, Dr. Emeka. It's always a pleasure talking with you and so much information and education.
Thank you very much.
So if you're out there, you're in our group of why won't this girl or this boy just add weight and be like their classmates? Yes. It's what they take in.
Yes.
Doc says be more patient. And for employers of labor, I will sing this one. 4 months. I did not know about
an
that.
Exclusive. Sometimes I wonder. I say, why do they say 4 months when exclusive breastfeeding is 6 months?
So they should give us 6 months.
I think they should give 6 months, and then the other feet, because the feet that you now introduce after the exclusive period, exclusive breastfeeding period, is also very important.
Wow.
So appropriate feeds introduced at that time in appropriate quantity and proportions are also important to sustain the good weight that the baby has. And the baby that is not gaining weight adequately, we need to investigate to find out the reason. If it is from inappropriate intake, because the doctor will ask questions, examine the baby, and do some investigations. And then, so that would make him understand the cause, because it's by understanding the cause that will make him solve the problem. So once you find out it is inadequate intake, you counsel the mother,
and then she's better informed and knows what to do. Okay, thank you so much, Doc. And I do hope you've gotten enough information. So for all the mothers out there who are a bit confused about their baby weight, even remember the chart. That's so important. Go with it, and if you have any questions, always get across to your doctor. Doctor on Demand comes right after this break.
Well, my name is Dr. Martina Agberian, welcoming you to your regular program, Doctor on Demand, and of course on a segment on mother care. How has your week been? I presume very, very well. And of course, for our fathers, mothers, and children, this is a family program bringing health to your doorstep. A question for today starts from somebody who sent a text message. It says, please, doctor, I have a year and 10 months old boy, child. He prefers to feed only on Cerelac than the normal foods, though his weight is okay. Not eating normal at this age gives me a lot of concern. Please, what do I do? This is a man who is saying that his a year and 10-month-old child prefers to feed only on Cerelac than the normal food, and his weight is okay. Well, for a year and a 10-month-old child feeding only on Cerelac, that is totally unacceptable, because that child needs much more than Cerelac. That child at this time, this period, needs to take more, gain more from the adult food that we have. There are lots of food out there that the child can actually feed on. You can give the child pap mixed with crayfish, well blended crayfish. That is a very, very good nutritional food supplement the child can take. You can actually do your own mashed yam, mashed potato. In Africa, we have a lot of things that child will benefit from. If you do mashed potato or mashed yam with red oil, that is actually going to be very good for the child. Then you also have vegetable soup, the ones that are a bit, that has okra, that it's easy for the child to swallow. You can do that. If you eat your food and the child is beside you, you can actually feed that child. But because you have concentrated on giving the child just cereal, like the child is getting so used to it, I can assure you, if you have variety, that child will eat more and take more. So Cerelac is not sufficient for that child. Ensure you give to that child what you are also taking as an adult. Then the next person says, please, how can a baby of 3 months, 2 weeks go on Cerelac food? How can a baby of 3 months and 2 weeks go on Cerelac food? No, 3 months and 2 weeks, I expect that at this period, that child should still be on exclusive breastfeeding. It is not time for you to start weaning that child. Weaning means adding other food supplements. That child should still be on exclusive breastfeeding for at least 6 months before you add any other thing like the water and other cereal food. But for 3 months and 2 weeks old baby, no, you can't do that at this age. Then my boy is 4 years and slim. I like plumpy children. What will I do to make him fat? This is actually very funny. Now you have sent me a text saying that your 4-year-old is slim, but you like plumpy children. The next text I'll get from you will be, my child is too plumpy. I want the child to be slim. So father, mother out there, thank you so much for taking care of these children. Ensure that you give them enough fruits, vegetables, and enough water, because they need it to grow. And mothers, don't forget to take your children for immunization, because it is very, very necessary, and you make the children stay away from diseases. Same time next week, we'll be back on your program, Mother Care. And of course on your segment, Doctor on Demand. Thank you for staying with us, and God bless you.
All right, I do hope you've had enough information on the show today. I personally have learned something new. I ought to have had 4 months. I ought to have had 4 months. So for you moms out there, 4 months after birth, okay, that's what your maternity leave should be. It should be, but you know, it's just very important. Be patient with your children. Kids can have tantrum when it comes to eating. Be patient with them, and then eventually they would get the weight. And if you have any questions, remember, go see your doctor. Go see your doctor. Don't believe all the old wives' tale, you know. Just go see your doctor and be sure that it's nothing to worry about. Thank you so much for being a part of the show. Thank you for your comments, your questions, and suggestions as to what we can handle on mother care. Of course, you'll be seeing all of that as you stay with us in the coming weeks. My name is Marian. Thank you so much again for being a part of the show. Remember, being a mom, the best job ever. Thanks for watching.